when it comes to heart health, getting a baseline of your labs is very important. And this month we are talking about heart health. So let's get into some of the blood work that I would want to look at if I was concerned about your cardiovascular health. Keep in mind, I'm not a cardiologist. If I can support your health in many, many ways, but if I see concerning lab work, or I just, even if I don't and I feel like something's off, I would refer you to a cardiologist, okay? And get a full workup there. So when I start labs with a functional nutrition patient, I will generally do the regular CBC, CMP, a lipid panel, A1C, fasting glucose, all of those things. I might even add in some serum nutrients like iron or B12, vitamin D, those types of things, depending on what we come up with in our consult and history. But if you have a family history of cardiovascular disease, or if you have a specific concern about your heart, then I will add some additional tests. Now, I always want those labs that I described above because I want to know how things are working and if they're working together. For instance, are your kidneys and liver working? Your kidneys and heart function are closely related, so I want to know how that's working. Your metabolic health is also very important because insulin resistance has a high, is strongly linked to cardiovascular disease. So we need to know that you're handling your sugars okay. Beyond the normal lipid panel, there are some advanced lipid testings. So adding an ApoB and a lipoprotein A to your normal lipid panel could give you some good information. For instance, the ApoB, or it has a longer name, measures the amount of plaque-forming particles, which is really great information. And the lipoprotein A is a genetically determined marker that increases your likelihood of stroke and heart attack. Now, this particular marker is not generally affected by diet or exercise because it is genetically determined, but it's really good to know if you have those. Now, after the advanced lipid panel, I would want to check inflammatory markers. And they're super important because inflammation is a primary driver for plaque forming in the artery. So I would also get a C-reactive protein to see if you have some systemic inflammation, and also homocysteine, which is an amino acid that at high levels can damage your artery lining and increase the risk of blood clots. So individuals having certain methylation or gene variant, like MTHFR gene variants, have are more likely to have higher homocysteine levels and would need to take a methylated B complex. Now, I hope you learned a little bit more about lab work for your heart. If it's been a while since you've had lab work done, or lab work for your heart done, February is definitely a wonderful month to do that. You can call the office or make an appointment online at thiclinic.com. I hope to hear from you soon, and have a great month.